All right, we're about to dive into a topic that millions, and I mean millions, of people deal with, but almost nobody talks about. In this explainer, we're going to pull back the curtain on diagnosing piles, giving you a really clear path to understanding what's going on and, most importantly, finding some relief.
Look, let's just be real for a second. This can feel, well, awkward. It's an embarrassing thing to bring up. But that feeling, it's what often makes people put off getting help, and that can just make things worse. So our goal today is simple. We're going to swap that anxiety for clarity and give you the straightforward info you need.
So, here's our game plan. First, we'll talk about why this is such a common but unspoken problem. Then, we'll get into the warning signs your body might be sending you. After that, we'll walk through the actual diagnostic journey, step by step. We'll cover the red flags for when you need urgent care, talk about finding the right experts, and wrap up with how you can take that all-important first step toward relief. Okay, let's start with the big picture here. Piles, or hemorrhoids, affect a massive number of people. It's because it's so hush-hush that a lot of folks just suffer in silence. But just understanding the condition and why getting it checked out early is so critical, that's the first real step to taking back control.
So what are we even talking about when we say piles? Well, in the simplest terms, they're just swollen blood vessels. They're located in and around the rectum and anus. And the most important thing to remember here is this is incredibly common. And even better, it's very, very treatable.
So why all the fuss about getting diagnosed early? Well, it's about a lot more than just being comfortable. An early diagnosis is crucial because it helps rule out other more serious conditions. It also means that treatment is usually way more effective and simpler. And it helps you sidestep future complications, like blood clots or even needing surgery down the road. Okay, so how do you even know if you should get a checkup in the first place? It really all comes down to learning to recognize the warning signs. Basically, listening to what your body is trying to tell you. The symptoms pretty much fall into two main camps. First, you've got the visible or physical signs, things you might actually see or feel. We're talking about bright red blood on the toilet paper, maybe a lump or some swelling, or just general pain and itching. Then you've got the internal symptoms. These are more about a sensation, like that annoying feeling that you haven't completely finished a bowel movement. Recognizing any of these is the key. So, you're noticing some of those signs. What happens next? This is the part where a lot of people get nervous, right? It's that fear of the unknown. So let's just walk through exactly what you can expect during a consultation and take all the mystery out of it. Honestly, the process is usually really straightforward. It all starts with a simple chat about your symptoms, your diet, your medical history, that kind of thing. Then there's a quick visual inspection. Finally, a digital rectal exam or a DRE. Now, I know that sounds uncomfortable, but it's an incredibly fast and simple way for your doctor to check for any internal issues. It's typically over in just a few seconds. Now, depending on what that initial exam shows, your doctor might need a clearer picture, and that's where some more advanced tests can come in handy. An anoscopy just looks inside the anal canal. A proctoscopy goes a little bit further. And if a wider view is needed, something like a sigmoidoscopy or a colonoscopy might be recommended. These aren't always needed, but they're fantastic tools for getting a super precise diagnosis. Okay, this next part is incredibly important, so please pay close attention. While most cases of piles are not emergencies, there are some very specific red flags that mean you need to get medical help immediately. It's so important that we know how to spot them. So if you're experiencing heavy bleeding that doesn't stop, or a sudden severe spike in pain, or you feel dizzy or faint, or you have a fever along with pain in that area, please do not wait. These are all signs that you need urgent medical attention right away. So now we get the problem, we know the symptoms, and we understand the process. Let's talk about the solution, because finding the right medical team, it's everything. A good diagnosis and an effective treatment plan really depend on having specialists with plenty of experience and up-to-date facilities. So what does that quality care even look like? Well, it often comes from places that are known for being trailblazers in their field, places that combine advanced medical treatments with a really compassionate human approach. That's the kind of standard you should be looking for. And that kind of leadership is almost always built on just tons of experience. Think about it. A specialist with over 4 decades of practice brings an incredible depth of knowledge to the table. That's the kind of experience that can make all the difference in your care. And, it's not just about one expert. A whole team of seasoned specialists is a really powerful sign of high-quality care. You want to look for a place where you've got multiple professionals bringing their deep, specialized experience together for their patients. So to kind of sum it up, here's a quick checklist for when you're seeking care. You're looking for experienced specialists in this specific area. You want modern equipment for an accurate diagnosis, and you absolutely deserve an environment that's comfortable and private. That whole package is what quality care is all about. We have covered a lot of ground. But you know what? It all comes down to this one final, crucial step, actually taking action. This is about empowering yourself to go from feeling uncomfortable and unsure to feeling relieved and in control of your health. And a positive outcome is a very real thing. The end goal here is to find care that's not only skilled but also compassionate, leading to an excellent experience overall. Getting the right help means you feel heard, you feel respected, and ultimately, you feel better. So if there is one single thing you take away from this entire explainer, please let it be this. Acting early is your absolute best strategy. It almost always leads to better results with much simpler, less invasive treatments. The most important thing you can do is just don't suffer in silence. So we'll end on this question. Now that you're informed, now that you understand the path forward, what does taking that first step towards relief actually look like for you? The power to change things for the better is right there in your hands.